Hello and welcome to Tech Talks, the People and Planet podcast. Today, we have Michael Lloyd joining us, the co-founder of RiskAverse Health. Michael brings a really unique perspective in personal experience and mission-driven approach to revolutionizing the healthcare system. So today we're really going to be diving into the insights that Michael has gained from navigating those complexities of the healthcare system and building solutions to really drive early detection and intervention. So, Michael, it's an absolute pleasure to have you on the show.
Thanks for having me, Tony. Appreciate it. And thanks for the opportunity to share a little bit more about what we've been working on.
Yeah, no problem at all. Really keen to dive into it. So I think just, to kind of sort of kick things off, I know I kind of sort of mentioned, a little bit in that intro there that the kind of sort of journey with RiskAverse Health ultimately sort of started from your standpoint with a personal experience within the healthcare system. So I wondered if you could kind of maybe elaborate on that and maybe the sort of specific challenges that you actually encountered that really motivated you to start RiskAverse Health and push things forward and better the system.
Yeah, really, there's kind of two things that went into this. One, my co-founder, Kaushik Viswanathan, who's also an extremely brilliant person, he was working in late stage cancer detection initially and kind of had the realization that when you get to that late stages of cancers, the outcomes are just, minimal at best and really bleak, and wanted to take a look at shifting that more towards, earlier interventions and how can we get to patients beforehand before they get to these late stages and actually improve their day-to-day life. And sure. When he kind of came up with that idea, he came to me because I myself have, I'm very young, but I've had a slew of injuries, a number of procedures throughout my entire life thus far, probably in the past decade. And with that kind of came a couple of chronic musculoskeletal and neurological issues. And that led me into seeking a lot of my own care. When I was doing that, it felt like an extremely lonely process and felt like oftentimes the system wasn't really listening to me and helping me with my individual needs. That led me for a while to really kind of almost deteriorate in my process mentally and physically as a result of that. And so I knew I wanted to be in the healthcare system myself, originally as a provider, and helping to prevent kind of similar cases like mine where people get lost and the outcome becomes bleak like mine. So Kaushik came to me with that idea, and I knew that I was immediately hooked around it, around that idea of starting that earlier. We need to educate people a lot earlier in that process about how they can seek their own care, what care is right for them. And then from that, really ensure that they're getting the best care for them in that process. Oftentimes you find yourself with a health plan, maybe advising, a health plan, health insurance, advising on a particular program they think is best, and a provider thinking that another program is best. At no point during that discussion was the patient actually involved in it. And so we want to really shift that towards a much more patient-centric model that starts earlier in that initial process.
Yeah, no, absolutely. That makes total sense. And so, obviously it's clear that, RiskAverse are focusing on that early detection and I guess intervention really as well. What sort of critical gaps or deficiencies in the healthcare system really prompted the emphasis, I would say, on that sort of early stages rather than kind of sort of latter stage interventions, and I guess how did that overall kind of approach your mission towards what you're trying to achieve?
Yeah, I think right off the bat, the first thing is that a number of approaches to healthcare is a very reactive state. A patient gets sick, they seek care at that point. But as we've learned over the years, especially in the last 20 years, how much of an emphasis your day-to-day life can have on your health throughout that process is going to determine kind of if you do get sick and can even prevent that. So we wanted to, put that emphasis on, instead of a reactive response from the system, let's be proactive in the way that we're engaging individuals and helping them seek their care. And so that was one of the big pieces that we wanted to address with that. The other side of it is also that members when they're engaging with their insurance company or their providers, aren't really knowledgeable about exactly how they can approach that system and advocate for their own needs within that. And so if you can get to them much earlier, educate them about what is available to them and determine what is best for them as well, you're going to get a much more positive patient experience, build a lot more trust with the patients or the members, depending on who it is we're working with, and develop what will become a much more healthier and happier individual as a result of creating that much more proactive process.
Sure. No, definitely. Yeah. I guess the emphasis that you're putting on engaging members digitally is, and considering, I guess, factors like preferences of care and readiness for change and that sort of thing is most definitely intriguing and certainly solving a real world problem as we say. So I guess how do you or how does RiskAverse Health use digital solutions to holistically engage with patients, addressing psychological aspects and things like that, and what impact have you kind of observed so far with that?
Yeah, so really, I think especially after COVID, the emphasis towards a bigger need for digital solutions that can engage members and care for members became of a major emphasis. Not that it wasn't there before, but it definitely accelerated that need and brought it to the forefront of everyone's attention. And for that, the healthcare system itself has, generally used simple messaging like emails and text messages to kind of blast out to all of their members or their patients. And it's not really taking an individualized approach into who that person is when we're actually engaging them. And that's only kind of the best case scenario when it comes to digitally engaging patients. A lot of times it's still phone calls. It's still a person trying to get out and outreach to that person. And most people don't pick up the phone actually when they're being called by a number they don't recognize. And so that becomes a lot of effort for the system and a lot of failure in terms of actually successfully engaging people through that manner. And so we know that we need to be digitally engaging them and doing that through channels that are ideal to those members, finding where they actually are, finding where you can get that patient's attention and draw them into a kind of a conversation with them about what their needs are within kind of their own care preferences. And so that's where that psychological aspect that you think or mentioned here comes in. And RiskAverse isn't just, once we're engaging them, asking them their medical history questions and things like that that can get you to a decision. And that's kind of what has been done to date, is really just asking those types of questions, finding a solution for that person that fits into the model of the plan or of the provider's care plan. But really, you need to look beyond that with kind of, where is that person in their journey? What are they willing to actually do in terms of addressing their care? What kinds of people do they want to be seeing? What providers are best for them? Is it a particular gender, a particular age, experience? Things like that often get missed during that process. And so our platform engages members through those channels digitally that are ideal for that member, drops them into a kind of a questionnaire or a conversation with them where they can express their own needs and intents around their healthcare journey, and then creates a decision and a recommendation around what that individual person should do based on their needs. And it adapts with them over time. It's not just, one-off recommendations. We're tracking them as they kind of through this, checking in, making sure that they actually are getting the successful care they need. And if maybe that isn't the case, we're adapting to that and doing that much more pliably with these individuals and ensuring that over time we get to the best care for them. And that's where our biggest kind of focus right now is on that idea of being able to understand the individuals themselves and direct them to that care, so that over time our platform and our algorithms and learnings get stronger and are much more able to engage with these members on a personal, individualized level and improve their care and their experience in the long term.
Yeah, no, sure, absolutely. I mean, that sounds really great, and as I say, it's certainly taking strides towards solving what is a genuine problem. And so I think obviously with as you kind of sort of mentioned there, there's obviously a primary focus on health plans. What kind of sort of advantages, I guess, do you see in that particular market segment? And I guess certainly with and it's the same across the US and the UK, potentially even a little bit more so in the US. I guess the whole kind of sort of landscape is a little bit of a minefield. You've got your healthcare providers, you've got insurance companies, different health services systems. So how do you navigate that? And as I say, what are the kind of sort of advantages of that particular market segment?
Yeah, and so like you mentioned, it's our primary focus is around health plans, but we do work with kind of the full industry, really thinking about organizations that are risk bearing, meaning they're responsible for the health of the members and have a priority towards keeping them as healthy as they possibly can. And so that could be, provider groups, health systems, et cetera, within that. But with the health plan, the way we looked at it is that a member in America, and I would, across like the entire system, needs to have, insurance. And with that, right, that's where they start. Every year, they're starting at what is their coverage. And that means that is where their first point of contact with the system is going to be annually. And so we saw that as, with that idea of being early with intervening with members, it was a prime opportunity to not only determine the health needs of the member, but then pair that with their coverage. So because the coverage becomes a really hard part when it comes to actually navigating your care. And most people struggle. It's over 80% of individuals are not comfortable with actually navigating their own benefits. 88% of individuals are not medically literate as it's determined. And so being able to pair those two components together allows for us to really holistically understand what that member needs within their own coverage boundaries. Because it's not enough just to give someone, a suggestion or a recommendation about their care, but then their actual plan doesn't cover that type of program, right?
Sure.
That's going to lead to a lot of frustration and honestly a feeling that you're not being heard, you're not being listened to. And so that's why we saw health plans as one of the primary places we needed to focus our efforts. And with that, they have great relationships across the continuum, whether it's with pharmacy, whether it's with the health systems themselves, provider groups. I could go on and on when it comes to that. But if you're starting at the primary point where people are entering into the system, allowing for that, you can kind of work with the plans themselves, the insurance companies, towards driving these members downstream to the care that they need with the appropriate coverage, so that you're not getting into the issues of surprise bills. That's a massive issue that comes up often, or wasting time seeking for care that you never even had covered. Those are major issues I myself went through, and I know is still a problem for patients and members in the system. So with that, really, that's why we think we're having such great success with plans as well, as we kind of gone through that. And so in terms of the actual outcomes of what we've seen is that when we engage members or health plan members through our platform, those that go through our platform actually are 7 times more likely to enroll in a care service. And so you've got about 92% of the population that aren't up to date on their care services on an annual basis. And so what are some of those problems? It's not being able to truly understand what care you need, the coverage that you have, and then execute on what is the ideal solution for your personal circumstances. We're solving that. We're helping to create an easy funnel for these members to engage in and then hand themselves to the program that is best productive for them particularly.
Sure. No, very, very insightful. Thank you for clarifying that. So look, I guess, in terms of RiskAverse, you've certainly been making a few waves in the industry. I know that you've secured some pretty notable clients. I appreciate you probably can't go into specifics on that just yet, but I wondered maybe if you could, I guess give us a bit of insight into some of the challenges, maybe some sort of pivotal moments in really kind of establishing relationships or partnerships within the sort of healthcare industry.
Yeah, absolutely. We work with, some of the largest insurers in the American healthcare system, and we're truly honored to be able to have our platform out there with working with these entities. It's been a fun journey, and yeah, there's been some learnings, and there's been, adaptability, I would say, across that experience. And so one of the biggest things that we really learned is that having a single solution isn't necessarily that we want to fit into their kind of operations is not going to work. And each of these plans have completely different requirements and expectations of their members based on their coverage, based on what they think is right. And so we focused ourselves much more so on adaptability so that we can support the plans with their outreach rather than necessarily generating and dominating it and telling them exactly what they have to do. We can accommodate their words. We can accommodate their learnings. We white label our solutions so that it comes out through their brand and they can build brand trust associated with their members themselves. And then also secondarily, the other piece of it really is that the system is hard to get into. You have to really build your network out. And we've been so thankful to have some amazing advisors across the entire industry. We have people that are, renowned doctors, as well as those that have built their own companies up into, rocket ships in the space. So across that, we have advisors that can help us get to where we're going and advise us and make sure that we keep ourselves on the right track towards actually ensuring advocacy for members, for patients in a way that works with the system itself and can continue to adapt with them and connect to additional people as we continue to grow.
No, that's super impressive. Love to hear that. So I guess sort of shifting focus slightly, considering the, I guess, forever really evolving landscape of healthcare tech. From your perspective, obviously being kind of ingrained in that space and kind of foreseeing, I guess, what could potentially be coming up. What sort of trends do you see influencing that sort of, I guess, sort of digital health space over the next sort of few years? And it sounds certainly like you are, but I guess it'd be good to understand how you're kind of sort of positioning yourself to adapt to those potential changes as well.
Yeah. So, I would say, again, about 20 years ago, there was a shift towards more interventions with members outside of the doctor's office, solutions that you can be using on your phone, whether it's for telehealth or, maybe it's diabetes management or disease management solutions that take it outside of the office so that you're not just, once a year talking to your physician. You're now having, advice and solutions that can care for your particular conditions very well in terms of, more of that digital scalable approach. Then, and with COVID, that really came to the forefront, right? Now
Sure.
We needed digital solutions that could allow for members and patients to actually receive the care they need because they couldn't even go into the office. But the problem is that despite that, a lot of these solutions are unbelievable towards delivering the care they need, but the plans and the health systems themselves aren't necessarily equipped for engaging their members on that individualized level to get them to the programs themselves. And so a lot of these solutions, care delivery solutions is what we like to call them. Those are like your disease management, telehealth, things like that, are also trying to engage these members with, marketing materials about their program. But if you look at from the members' perspective, it's a very limited scope in which they're being engaged. It's, hey, this is a great program for you. And that's not necessarily the ideal program for them. They need a way to advocate for themselves, pick their own journey, get all of the information and determine based on kind of the overall continuum of recommended services, what is the best one for them specifically, so that the member is really at the forefront of their own care and empowered to make those decisions themselves, rather than say more interventionally, I would say, or invasively targeting them with a particular solution. That's one of those goals that we really see being wildly important for it. The other one is that the importance of tech coming up is vital. We mentioned a little bit about how we're trying to individually engage members through, emails, texts, etc. Right now, it's very phone call centric, and we've got an overworked kind of workforce. Care managers, nurses, visit providers, all of them are very overworked. And if we know that the solution is to engage these members more frequently and guide them through the system, they need more work to help be carried through that. Putting more burden on an overworked system seems like a losing recipe right there. And so we need digital solutions that can support these workers and allow for a much more scalable solution that can deliver the same compassion associated with a one-on-one conversation, but can get the member through the process on their own via that scalable solution. And I don't think that we are here to replace by any means those kind of phone calls. There are members that are high touch. There are members that absolutely need that. But right now, with the reliance on phone calls to date, it is leaving time away from those high touch members that you need, or away from your work afterwards that you might have beyond just caring for patients. And this gives a burden off of those individuals throughout that process, while also bringing the consumer to the forefront of their own care, the patient or the member to their own care. So those are the two pieces we look at, and why we think we need a solution that can help support that system, consider the whole slew of the opportunity for each member, and drive them into the care that they need on their terms.
Well said. No, I love that. Appreciate that. Look, I think that's super valuable insight. And again, thank you for your time today, Michael. I think that's probably about what we have time for. But again, thank you so much for sharing your valuable insight into the episode today. So look, obviously I'm really excited to continue to watch the journey of RiskAverse Health. I'm sure this is just the start for you guys. So really excited to see where this goes for you. I think what you've done today is really provided a real good glimpse into what the future of healthcare technology can look like. So again, thank you so much for your time. Obviously, for anybody listening, if you have found this conversation insightful, please give us a like, subscribe, comment, and of course, obviously, check out the great work that they're doing over at RiskAverse Health. Again, thank you again, Michael, for your time. It's been an absolute pleasure to have you on the show.
Tony, thank you. Appreciate all the time.
Cheers. Thanks. Take care.
All right. Bye now.